Climacteric syndrome, aka climax, is a period in a woman's life, during which the work of the ovaries decreases, and the amount of hormones produced by them decreases. The main result of these physiological processes is the cessation of female reproductive function. The period of menopause in most women occurs after 48 to 52 years. Its symptoms include both hot flushes and sweating, as well as the risk of developing serious diseases. That is why it is necessary to monitor menopause, regularly visit a doctor, and perform prescribed diagnostic procedures. Menopause in women does not come immediately. The climacteric period includes three main stages: previous or premenopause. Menstruation does not stop, but ovarian function decreases. The stage lasts up to 2 years. Menopause caused by the cessation of menstruation. The beginning of the period is considered the absence of menstruation for 12 months. It usually occurs at the age of 50 to 52. Postmenopause. This stage is characterized by a further decrease in female sex hormones until the ovaries stop functioning. The duration and time of manifestation of these stages are individual and depend on various factors, including the lifestyle and state of health of the woman. Climax is also distinguished by the severity of manifestations, first or easy degree. It is characterized by infrequent, up to 10 times a day, tides that are present. The main manifestation of climacteric syndrome, second degree or secondary. Symptoms are more pronounced, and hot flushes are the only manifestation of this condition, severe or third degree. The signs of menopause are strongly expressed, not limited to hot flushes, the number and frequency of which is quite large, more than 20 times a day. Work capacity decreases, the general state of health significantly deteriorates. Symptoms of menopause. The previous stage, before the onset of menopause, often occurs without obvious signs. But the opposite happens when a woman is bothered by not one, but several symptoms at once. In addition, in different periods of time, manifestations can seriously differ. The early signs of climacteric syndrome include hot flushes, goosebumps, sweating, accelerated pulse, headaches, pressure jumps, sudden changes in mood, sleep problems, memory impairment, decrease in sexual desire. When menopause occurs in women, menstruation stops. Other signs in this period of the development of the syndrome include the following: dryness of the skin, as well as mucous membranes of the genital and urinary tracts. Painful sensations during sexual intercourse, enuresis, muscle and joint pains, hair loss in the future. After menopause, various complications of menopause are possible: hypertension, atherosclerosis, osteoporosis. It also increases the risk of developing diabetes, decreases hearing, vision and mental abilities. In order to prevent these diseases and problems during the menopause, women are recommended to visit a doctor regularly, monitor their health and adhere to the prescribed treatment. Diagnostic examinations of climacteric syndrome are carried out by gynecologists of our clinic. They examine and interview the patient, establish the relationship between menopause and various manifestations of menopause. An important task of diagnosis is the identification of concomitant diseases, such as hypertension, diabetes, etc. In the climacteric period, women may be prescribed various studies, in particular, laboratory tests for hormones, lipid spectrum, coagulation, cytological and microscopic. Their purpose is to rule out the presence of atypical cells in the cervix. In order to prevent the development of menopause complications, such types of research as ultrasound of the pelvic organs, mammography, radiography of bone tissues, and ECG are used. Treatment of menopause. Menopause is a physiological process that occurs with age in any woman. Therefore, therapeutic action, as a rule, is aimed at minimizing negative manifestations, that is, facilitating the course of menopause. So, with a mild degree of the syndrome, special treatment may not be necessary at all. In the presence of minor complaints about the general state of health, the following are prescribed: hormone replacement therapy, vitamins, primarily A, C and group B, physiotherapy, in particular massage, etc. It is also recommended to follow a balanced diet during menopause. With a large number of unpleasant manifestations, average severity of menopause, antidepressants and medications that normalize blood pressure may be indicated.